The topics to be covered today are what is the basic concept of a healthcare team, what is the role of clinical pharmacist as a member of the healthcare team, and important functions of pharmacist as a member of the healthcare team. Coming to the healthcare team and the role of pharmacist, the healthcare system is composed of physician, pharmacist, nurse, the staff, and other paramedics. Coming to the roles of physician and other medical and dental staff, they are primarily involved in the diagnosis of the disease, the prescription, monitoring of therapy, and medical care. The pharmacist role involves prescription monitoring, dispensing of the drugs, patient counseling, monitoring of the therapy, as well as prescription monitoring, pharmaceutical care to the patient. The nursing staff plays major role in administration of the drugs, monitoring and providing nursing care along with other paramedical staff. Responsibilities of the clinical pharmacist are diverse and these include they interact with patients and maintain their complete and exhaustible medical history. This is an important part of their job because maintaining medical history helps the pharmacist know what previous drugs a patient has taken, what are the various drugs to which the patient has not responded in the past, and what are the hypersensitivity reactions that might have occurred in the past, and several other things can also be included in these records. The second important function of pharmacist is the proper documentation of hypersensitivity or allergic reactions to certain drugs, food habits, drug dependence or intoxications to certain chemical substances, side effects, incorrect drug administration, etc. about the patient. These are important from a therapeutic point of view. For example, if a patient is hypersensitive or allergic to a certain drug or a drug class, that drug class cannot be given to the patient. The food habits of the patient are important because several habits, for example, drinking can lead to liver damage and the doses need to be adjusted accordingly. Drug dependence or intoxication to certain chemical substances is also an important consideration because the physiology of the patient might be changed. For example, opioids cause a reduction in GI motility, so drug absorption may be varied. And then side effects that might have occurred in the past due to a specific drug and incorrect drug administration could be there. For example, patients who are on insulin, they need to administer insulin subcutaneously, but they might be administering insulin via intramuscular injection, and the kinetics altogether changes when insulin is given by these two different routes. Then the third responsibility is check patient's medical history for drug-related interactions and patient's habits. This is an important part because drug interactions could precipitate in a patient due to several reasons. For example, the physiology of the patient and patient's habits are also an important contributor to these interactions. The pharmacist help physician in selection of a proper drug, product, or a generic formulation depending on the bioavailability and bioequivalence of such products. The pharmacist also help in monitoring drug therapy to ensure safety and efficacy of the treatment that is provided to the patient. Then monitoring of drug therapy involves various pharmacokinetic parameters are checked by the clinical pharmacist based on the plasma concentration of the drug, enzymes, and measurement of glucose quantity in blood, for example. Then designing health and drug policies and assist as a source of information for the healthcare professionals and to the public. The pharmacist plays an important role in defining the health policies and the drug policies of hospitals and act as a source of information for healthcare professionals and to the public for all drug-related information. Drug management relies on pharmacists to check selection, requirement, procurement, distribution, and use of the drugs. In hospital setups particularly, the pharmacists are actively involved in selection of the different drugs to be on the inventory of the pharmacy, the requirements of new drugs and existing drugs which have to be on the hospital formulary. The procurement and distribution of different drugs are overlooked by the hospital pharmacist, and the usage of drugs is also monitored by the pharmacist. Research and development in bioavailability of active ingredients. The pharmacist also plays an important role in clinical trials aimed at determining the bioavailability of different active ingredients and how these can differ between different marketed formulations. Then executing clinical trials, pharmacists play an important role in clinical trials, are involved in all stages like recruitment of volunteers, the screening of volunteers, the monitoring of the therapy, adverse outcomes, etc. Effective selection, utilization, retrieval of drug literature. Pharmacists play an important role in selection and utilization of drug literature. They are apt in studying various sources of literature to find out the information drug. For example, what are the drugs indicated for a particular disease, and which are the first line and second line drugs, which drugs cannot be given concomitantly with other drugs, drug interactions, adverse drug reactions in specific patient populations and in population and in normal population, etc.